Today I'm going to talk about liposuction scars. When consulting with my patients over the last 20 years, one of the most frequent concerns my patients have is scarring. More and more commonly, people come to us for scar revision surgery as well. Any kind of surgery will leave a scar since there will be some kind of incisions. For me, making invisible scars as possible is a very important goal for every surgery. Since with obvious visible scars, how can we say it is an artistic result of beauty? But before digging into the topic, I want to start with skin type. There are some populations who are blessed. Compared to Asian people like Koreans or Chinese or Japanese, scars are barely visible in Western people, especially Germanic people like Northern Europeans, Russians. From my experience, it seems they leave less obvious scars even if we pierce through anywhere on the body and have surgery. The main reason here is that these ethnic groups of people have very little melanin. When I meet patients, some patients tell me that they are very sensitive to scars. Others will say, I'm fine as long as the result is good. And believe me, even for those who said that before the surgery, 100% the scars will catch their eyes after the surgery. And they start caring about what they wear and end up with getting really stressed every time they notice them. Secondly, I want to talk about liposuction incisions. In the case of regular arm liposuction, surgery is most often performed with incisions at the inside of the armpits, one in the elbow, and sometimes in the front armpit as well. So it could be 2 or 3 incisions in total. For regular thigh liposuction, for the front side, 1 or 2 incisions on each groin area, and another below the knees. So most commonly 2 or 3 incisions in the front. And at the back of the thigh, if you are going to experience full thigh liposuction, common incision happens here under the flank and another in the panty line here. So it's going to be 2 more. So in total, it could be up to 10 incisions for the thigh liposuction. For abdominal liposuction, most commonly 1 incision at the belly button, 2 incisions in the groin area. Depending on surgeon's preference, incision here under the breast or upper abdominal liposuction, and here in the pelvis area for love handles. And liposuctions are also commonly seen about 9 incisions in total for full upper body. For back liposuction, 2 at the armpits, 1 piercing in the middle of the back area are very common incision area. And for lower back, many surgeons will also perform the surgery by doing the suction through upper buttocks and flank area here. 7 incisions are commonly happen for full back liposuction. For calf liposuction, the back of the knees and the ankles are common incision areas. So commonly 2 or 3 incisions for calf liposuction. Personally, I hate making a lot of incisions. For abdominal liposuction, 1 incision inside the belly button, not outside, and 1 in the pubic area, and another 1 incision at the tailbone. So it's going to be only 3 incisions, and they are all invisible. And for the whole back, I would add 1 incision in the armpit, so each side, so it's going to be 2. So for whole total liposuction of the upper body and arms, it's going to be 5 in total, and they are all invisible. So if you look at these photos, you can't really see the scars. It's not photoshopped. You can't see them. It is a photo of incision inside the belly button, tailbone, and pubic area here. When we perform the liposuction surgery using a cannula tube like this, it can burn or peel the skin, which will enlarge the scar after the surgery. So we are using a skin protector. This will prevent the possible skin damages. I know a lot of good clinics will use them, but there are some clinics that still don't use these kind of skin protectors. So don't forget to do some research before your surgery. For sure. First of all, we have several different sealing methods. Suturing from the inside and outside together will lead to the best results. If we suture from the inside, it will remain as a natural line, so it will become better suture from the inside. Many surgeons will not do like this. They just suture from outside. They claim that it's very small and does not care that much of that small scar. But I feel that suturing meticulously as possible is critical for least scar remaining after the surgery. Even though there are many different ways of suturing and many different ways to treat wounds after, but the suturing where and how is most important. But most importantly, making the least number of incisions will make huge difference. There are several things you should do after the wound healings. The most important thing is moisturizing the wound. You can easily get an ointment, usually silicone-based ointment. It would be very good for the wound, and it will leave less scar. The scars may get dark more easily if you don't keep moisturizing them. With silicone ointment or silicone tapes, you can prevent the scars from elevations. The elevation, we call it hypertrophic scar. If it's going to happen, you need to get some injections. We call it triamcinolone injections, and different doctors have different ways of treating them. However, triamcinolone injection can help you lowering the height of the scar. If you see scars becoming protruded and elevated, then you must tell your surgeon and visit the clinic as soon as possible. If you find this video useful for your inquiries on liposuction scars, if you've got any more questions, please leave them in the comments. I'd love to answer you. And thank you for watching and stay healthy. Bye bye!